The Morrison government started month and a half ago by saying that these coronavirus bans would last 6 months. And then it said, oh, well, OK, we'll discuss easing some bans on May the 11th. And then, as the heat turned up, it said, all right, we'll discuss it this coming Friday. And some states, as Western Australia, is easing them already, South Australia following. Joining me is one of the dozen economists and finance analysts and commentators 2 weeks ago signed a joint letter demanding the government open the economy much faster. He's Australia's top finance guru, Terry McCrann. Terry, thank you so much for joining me. This argument, first of all, of the Waleeds and the Albaneses and all that, that we must now listen to global warming experts like we listen to the health experts with this coronavirus crisis. Does that convince you?
Absolutely, Andrew. It convinces me to do the exact opposite, as I'm sure it does with you. Experts, schmexperts, in very simple terms. I think the evidence is very clear now that the two things that have led to this very good performance that we've had with the virus in Australia and New Zealand are luck. We got the virus flew out of Wuhan into a northern hemisphere winter and into a southern hemisphere summer. We know that viruses take off and explode in winter. They don't so much in summer, number one. Number two, what stopped the virus coming to Australia was stopping the planes flying. So what the Morrison government did very early, against the advice of one of these expert groups, the World Health Organizations, to stop the planes and the virus flying out of China. Those two things, I think, combined to deliver the outcome we've had. I would argue that the lockdowns have been very peripheral in the outcomes that we've had. And I would suggest to you and your viewers that they look at the flu statistics. We have the flu in summer. We just don't notice it in summer. It stopped happening in March, and then it really stopped stone dead in April. I think the big thing was that we were stopping people flying into the country with flu as well as the coronavirus.
But in the meantime, these bans have done enormous damage. I mean, I always argue for more targeted restrictions, particularly protecting the vulnerable. I still don't think we've done that properly enough. Well, you can see that from the deaths in some of these nursing homes. How much damage do you think we've done looking at it with, your finance eyes?
We're going to find out, Andrew, when we start sifting through the wreckage as we come out of these lockdowns. I think the numbers are very, very instructive. The Australian Bureau of Statistics has been way behind the game. It still hasn't told us really what the impact on the level of jobless has been. The statistics officially from the ABS tell us we only have 5% of the workforce unemployed. That was early in March, before things really started to freeze up. Gary Morgan does his surveys much more regularly, and he's telling us that something like 1 in 3 Australian workers are either out of work or have lost or would like to work longer hours. They're part-timers when they want to be full-timers, or they're on the JobKeeper program where they're effectively unemployed, but statistically they're not because they're still employed by the company. 1 in 3. Now that sounds bad enough, but think about this, Andrew. That's almost entirely happening in the private sector. That's almost entirely happening in the private sector. Hardly anyone in the public sector has lost their job. Hardly anyone in the public sector has had a pay cut. That tells me that probably half the private sector workforce has been battered by these lockdowns. Now, when you're the Premier, when you're in the health department advising the Premier, you don't really see that reality. And the reality, everybody out there is feeling that in the private sector, and that's the wreckage that we're going to emerge from when we come out of the lockdowns.
Oh, it's dreadful when you put it like that, because, of course, the private sector is the stuff, the part of the economy that makes things and grows things and creates the wealth that the public sector then spends. But Terry, I reckon the government should, and the media should be focusing on the costs with the same eagle eye that they focus on every single death of every single person in an aged care home. We should also have, focus on that, yes, but also on the human cost of the restrictions, which we don't see quite as much. That is hidden. How fast do we now need to drop some of these restrictions? I'm sick of hearing about returning to sport and all that. That won't pay the bills. What do we need to do to get the economy on the rolling again?
Well, just quickly on that matter about the home care situation. Nearly a third of our deaths have come from 2 home care facilities in Sydney, plus the Ruby Princess debacle. How did the lockdowns work in stopping those deaths? I mean, it comes back to this fundamental point that you've been addressing, Andrew, and which your critics completely ignore because it's inconvenient, that you're not talking about throwing all these people at the mercy of the virus. Focus the lockdowns where they will work effectively to stop and protect the people that are vulnerable, including old people like myself, but certainly people in aged care facilities or medically challenged. That's what you need to focus on. And yes, we need to maintain the bans on international flights. Stop the virus coming into the country, protect the people that are vulnerable to the virus, and actually let the economy function again. So I would move very rapidly to opening up the economy, not just bit by bit as we move through the next month, 2 months, because there's no point in the lockdowns anymore, provided you stop the virus coming in, and secondly, you protect the people that are vulnerable to it. The rest of the economy should be able to function.
I'll tell you how pointless the lockdowns are. I'm hearing now that some of the research into vaccines or whatever treatments are running into this problem. There's not enough people out there to test these vaccines with, and yet we're all locked up in case we might get struck, the 1 in a million chance. It's ridiculous. And finally, Terry, what's next year going to look like?
Very bad, Andrew, very bad. I mean, because it's not simply that we have wrecked our own economy, but the rest of the world has as well. And we've had this injection of massive stimulus, both from governments and from central banks. You can't live on ever more monetary drug taking, basically. So I think the idea that there's going to be any sort of V-shaped recovery is just complete fantasy. We're going to have at best some sort of weak U-shaped recovery, even if we start doing the right things. And let's not forget the other element in all this. You said before that the private sector creates the wealth, creates the jobs, creates the income. The public sector consumes it. Because the private sector hasn't been creating the wealth, the public sector is going to have huge debt and deficits. So we're not going to emerge into some sort of sunlit uplands where we can all go back to the way we were 3 months ago.
That's true. The government, though, is all the governments, state and federal, they're doing very, very slow return to work. These guys have got no sense of urgency. And really, there needs to be, I don't know where the business lobby is on this. Maybe they're all so scared of missing out on the gravy that's being thrown around that they don't dare say boo to a government that could also, on the other hand, close them down. Terry McCrann, thank you so much indeed for your time.